A diagram of a baby still inside the mother's uterus is shown.
Before an infant is born, the retina is one of the last body parts to develop. Much of the eye's blood vessel growth happens in the last several weeks before full term. So you can imagine what happens when an infant is born 2 or 3 months too early. It means that the retina isn't finished yet. The retinal blood vessels must finish developing after the infant has left the protection and nourishment of the mother's womb.
A newborn baby is seen in an incubator in a hospital. A side view of an eye diagram is shown to illustrate the development of the retina over time.
This is a drawing of an eye in which the retina is still developing. This is where the blood vessels have already grown, and here is where they haven't yet reached. In the new conditions outside the mother, this delicate growth process can be affected and retinopathy of prematurity can begin. Many factors seem to contribute toward causing ROP, but the primary reason is that the retina just isn't finished or mature at birth.
2 newborn babies are seen in a hospital. One is a premature baby who is 4 weeks old with monitors attached in an incubator, while the other baby is full term.
The smaller the baby is at birth, the less mature the retina, which leads to a higher risk of ROP. In fact, the great majority of all babies with a birth weight under 2 pounds 3 ounces will have at least some amount of the disease. On the other hand, ROP is unusual in infants with birth weights over 3.5 pounds.
A side view of an eye diagram is shown. It depicts an undeveloped retina with a thin line of tissue forming between the advancing blood vessels in the back of the eye towards the front. The words Stage 1 ROP are shown at the bottom of the screen.
The retinopathy of prematurity can first be seen as a thin line of tissue forming between the advancing blood vessels here and this area of the retina in which no vessels have yet formed. The area without vessels is called the avascular retina. This white pale boundary line is a sure sign to the ophthalmologist that something has gone wrong in the infant's developing retina. We call this Stage 1.
A side view of an eye diagram is shown. It depicts an undeveloped retina with the thin line of tissue worsening and becoming raised and wider. The words Stage 2 ROP are shown at the bottom right of the screen.
If the ROP continues to get worse, the white line becomes raised and wider, forming a ridge of tissue. This is Stage 2.
2 diagrams are shown side by side. On the left is an eye with Stage 2 ROP, and the right shows a healthy eye. The words Stage 2 ROP and normal flash once under their respective diagrams.
You can see how this ridge compares with a normally growing retina where the blood vessels just gradually grow into the avascular area. Notice that there are absolutely no blood vessels in the retina beyond the ridge.
A photo of an eye with ROP and large twisted blood vessels is shown. The words plus disease are shown at the bottom center of the screen.
The blood vessels before the ridge can become abnormally large and more twisted than they should be, and when they do, we call this plus disease.
A side view of an eye diagram is shown. It depicts an undeveloped retina with the thin line of tissue forming a ragged fringe of pink tissue. The words Stage 3 ROP are shown at the bottom center of the screen.
The vessels grow right up to the ridge and stop. If a ragged fringe of pink tissue begins to grow off the ridge, the eye has reached Stage 3 ROP. Most eyes with ROP do not get worse than Stage 3, but we will go ahead and show what can happen to lead to blindness.
A side view of an eye diagram is shown. It depicts an underdeveloped retina with scar tissue forming around the ridge of the thin line of tissue. The words Stage 4 ROP are shown at the bottom center of the screen.
Stage 4 is retinal detachment. Scar tissue forms around this ridge and sort of tightens up and pulls the retina inward toward the center of the eye. You might think of the eye as a hollow ball that is lined with a plastic wrap.
A side view of an eye diagram is shown zooming in on the detaching retina. The words retina detaching are shown at the bottom center of the screen.
Because the retina is not really stuck on like wallpaper, it's just clinging like a plastic wrap. Once it starts to peel off, it's fairly easy for it to keep coming off.
A photo of an eye with ROP and a retinal fold is shown. The words folded retina are written at the bottom center of the screen.
If scar tissue is pulling on it, it forms wrinkles or folds and can even pull off completely.
A side view of an eye diagram is shown. It depicts an eye with a detached retina. The blood vessels in the back now appear black instead of red, and there is a large red area around the retina where the retina used to be attached. The words detached retina stage 5 are written at the bottom center of the screen.
If it pulls completely off, we call that stage 5 ROP. Retinal detachment is a very bad consequence of ROP. The retina can't send a clear image to the brain if it's all wrinkled up.
A photo of a child with his eyes half closed is shown.
Remember, while this is an unusual outcome, when it does happen, it can lead to extremely poor vision or even total blindness.
A photo of an eye with ROP is shown with the words actual photograph of ROP at the top of the screen. These words fade to show the words active and later subsiding.
Retinopathy of prematurity is easier to understand if you divide it into two parts. First, the disease goes through an active phase, usually starting in the second and third month after birth. This is what we've already described. Then, as the activity subsides, the ROP starts to form scar tissue inside the eye.
A side view of an eye with scar tissue is shown. It fades to another diagram of an eye with a detached retina.
The more severe the ROP becomes during the active phase, the more scarring there is when it subsides. Scar tissue tends to shrink. If enough of it is present, it can pull the retina off the inner wall of the eye.
A photo of a smiling toddler girl's face with bright blue-gray eyes is shown.
Most infants who get ROP will recover with little or no scarring or eye damage. A smaller number will have some permanent retinal damage which can affect their eyesight even if the retina does not detach.
A photo of a toddler boy wearing glasses is shown. The words eyesight complications are shown at the top center of the screen.
Eyesight complications can be nearsightedness, myopia, lazy eye, amblyopia, or wandering eye, strabismus.
The camera pans across an eye specialist's examination room. A preschool girl is looking into a slit lamp for the eye care specialist.
Therefore, due to the possibility of ROP complications, many premature infants need lifelong continued eye care by a medical doctor. A small percentage of ROP victims become totally blind.